Imagine this: you're at home, perhaps alone, and suddenly you feel a tightness or discomfort in your chest. It's subtle. Maybe you think it's just a little indigestion or stress from the day. But what if it's more? What if this mild sensation is a sign that your heart is in danger? Heart attacks don't always strike with the dramatic, excruciating pain we see in movies. In fact, many heart attacks begin with mild discomfort that gradually worsens over time, often going unnoticed until it's too late. Understanding the early signs of a heart attack and knowing what to do can be the difference between life and death. Today, we're diving into the essential steps you must take to survive a heart attack, especially when you're alone. But even more importantly, we'll explore the critical preventive measures you can take to ensure your heart remains healthy and strong for years to come. These insights come from cutting-edge research and advice from top cardiologists, so let's begin with a powerful truth: every beat of your heart matters. 1. Recognizing heart attacks symptoms early. It's often said that heart attacks don't come with a warning. However, this isn't entirely accurate. In fact, the symptoms can be subtle, even unnoticeable, at first. According to the American Heart Association, a heart attack can start with mild chest discomfort, often mistaken for indigestion, or a tightness in the chest that may seem like a muscle strain. The discomfort may be transient, and people sometimes ignore it, assuming it will go away. However, Dr. Susan Bennett, a cardiologist from the Mayo Clinic, points out that even mild chest pain can be a precursor to a heart attack. It's essential to trust your body and act when you notice something unusual, no matter how minor it may seem. This initial discomfort may not feel like a traditional, severe chest pain, but could be a sign of an impending cardiac event. For instance, one patient I worked with described a persistent tightness in his chest during simple activities like climbing stairs. At first, he attributed it to mild exertion or age-related discomfort, but as the sensation grew more intense over time, he realized it was something more serious. Research by the American College of Cardiology reveals that about 50% of heart attacks present as silent heart attacks, with symptoms so mild that individuals don't recognize them until it's too late. The early signs may be subtle and occasional pressure in the chest, discomfort that radiates to the neck or jaw, or an unusual shortness of breath, but they should not be ignored. According to a 2020 study published in the Journal of the American College of Cardiology, individuals who act quickly during these initial mild symptoms significantly improve their chances of survival. Recognizing these signs early and seeking immediate medical attention is crucial. 2. Immediate action is life-saving. The importance of swift action during a heart attack cannot be overstated. Research consistently shows that timely intervention dramatically reduces the risk of severe heart damage. Every minute that passes without blood flowing to the heart muscle results in the death of heart tissue. A study by the American Heart Association found that for every minute of delay in receiving treatment, the survival rate decreases by 7 to 10%. This fact underscores the importance of acting immediately when you suspect a heart attack. Time is of the essence. Don't wait for the pain to dissipate or for the symptoms to subside. Calling for emergency medical help right away is the first crucial step. This is especially true if you're alone. Dr. Joseph Hill, a cardiologist and professor at UT's Southwestern Medical Center, emphasizes that seeking help promptly allows for faster administration of clot-busting treatments or surgery, which can prevent extensive heart damage. Additionally, Many patients mistakenly believe that a heart attack must involve excruciating pain before it requires immediate attention. This is a dangerous misconception. As noted by Dr. Janet Weinstein, a leading researcher in cardiovascular health, many heart attacks begin with mild, intermittent discomfort that increases over time. The pain may feel like indigestion or muscular soreness, and people often hesitate to act until the symptoms become undeniable. This delay can result in a more severe heart attack and worse outcomes. 3. The dangers of self-transport and why you should avoid it. A critical mistake many people make during a heart attack is trying to drive themselves to the hospital. It may seem like a good idea in the moment, especially if the pain is not severe, but driving while experiencing a heart attack is highly dangerous. Heart attacks can cause dizziness, fatigue, and fainting, which could impair your ability to safely operate a vehicle. The American Heart Association reports that individuals who attempt to drive themselves to the hospital during a heart attack are at risk of passing out behind the wheel, causing accidents, or worsening their condition. Instead, it is always safer to call emergency services. In most cases, trained paramedics will arrive with necessary equipment to stabilize you on site and provide advanced care en route to the hospital. Dr. Thomas M. Venero, a cardiologist from the Cleveland Clinic, underscores the importance of not self-diagnosing or self-treating during a heart attack. Instead of wasting time on potentially dangerous self-treatment options, the priority should be to call for immediate professional medical assistance. Delaying treatment could reduce the chance of successful intervention. 4. Emotional control. When facing a health emergency like a heart attack, remaining calm can significantly affect the outcome. Dr. Sandeep Jalgarhar, a cardiologist and author of Heart, A History, emphasizes the connection between emotional stress and the exacerbation of heart conditions. He explains that stress releases adrenaline, which increases heart rate and blood pressure, making the heart work harder. This can cause further damage during a heart attack. To mitigate the effects of stress during a heart attack, Dr. Venero recommends focusing on slow, deep breaths to calm the nervous system and reduce anxiety. This approach slows down the heart rate, lowers blood pressure, and reduces oxygen consumption, which can help you survive the event while waiting for medical assistance. Studies by the National Institutes of Health, NIH, show that managing stress in these critical moments can drastically improve outcomes, making emotional control a key aspect of heart attack survival. 5 Myths surrounding heart attack management. One of the most common myths surrounding heart attacks is the idea that coughing during a heart attack can help circulate blood and relieve symptoms. However, this is false. The American Heart Association, along with several leading cardiologists, has repeatedly debunked this theory. Coughing does not dislodge a clot, nor does it increase blood flow in a meaningful way during a heart attack. Instead of relying on unproven methods like coughing, it is critical to stick to what we know works, calling emergency services immediately and following their guidance. In some cases, first responders may recommend aspirin to help prevent clot formation. However, this should only be done under medical supervision. Dr. Michael Miller, director of the Center for Preventive Cardiology at the University of Maryland, points out that aspirin can help prevent blood clots during a heart attack. But it must be taken with the right dosage. While aspirin can reduce the chances of further damage to the heart, it is essential to understand that it is not a substitute for immediate professional treatment. 6 Heart attack prevention. Prevention is the cornerstone of heart health, and research shows that lifestyle modifications can prevent up to 50% of heart attacks. According to a study published by the American Heart Association, a combination of a healthy diet, regular physical activity, and routine health checkups can significantly reduce the risk of cardiovascular diseases. Diet. The role of a healthy diet cannot be overstated. Research conducted by the Harvard School of Public Health demonstrates that diets rich in fruits, vegetables, lean proteins, and whole grains significantly lower the risk of heart disease. Conversely, high intake of sodium, sugar, and refined grains has been linked to an increased risk of heart attacks and strokes. Exercise, physical activity is crucial for heart health. Studies by the American College of Cardiology consistently show that individuals who engage in regular aerobic and resistance exercises experience better cardiovascular outcomes, lower blood pressure, and a decreased risk of heart attacks. Dr. Michael R. Lauer, Chief of the AHAS Clinical Trials and Translational Medicine, stresses that exercise helps improve the health of the arteries and heart, making it one of the most effective preventive measures. Monitoring risk factors. Regularly monitoring your blood pressure, cholesterol levels, and blood sugar is crucial for heart attack prevention. As Dr. Emily Schreiber, a cardiologist at Johns Hopkins Hospital, explains, controlling these risk factors reduces the strain on the heart and helps prevent conditions that lead to heart attacks. 7. The importance of managing risk factors. Managing the risk factors that contribute to cardiovascular disease is essential in preventing heart attacks and ensuring long-term heart health. High blood pressure, diabetes, high cholesterol, and obesity are all significant contributors to heart disease. These risk factors are often manageable through regular monitoring, medication, and lifestyle changes. Blood pressure. High blood pressure is one of the most prevalent risk factors for heart disease. According to a study published by the American College of Cardiology, ACC, individuals with uncontrolled hypertension are at a significantly higher risk for heart attacks and strokes. The American Heart Association emphasizes the importance of checking your blood pressure regularly, especially for individuals over 40 or those with a family history of hypertension. If you have high blood pressure, your doctor may recommend lifestyle changes or medications such as ACE inhibitors or beta blockers to help control it. Diabetes. Diabetes is another critical risk factor for heart disease. People with diabetes often have higher levels of glucose in their blood, which can damage blood vessels over time, increasing the risk of heart attacks. According to the American Diabetes Association, those with diabetes should aim to maintain healthy blood sugar levels through proper diet, exercise, and medication, as uncontrolled diabetes is closely linked to cardiovascular events. Dr. David Nathan, a leading researcher in diabetes care at Harvard Medical School, stresses the importance of consistent monitoring and treatment for diabetes to prevent heart disease. Cholesterol and lipid levels. Elevated cholesterol, particularly low-density lipoprotein, LDL, or bad cholesterol, contributes to plaque buildup in the arteries, narrowing them and restricting blood flow. A study from the Journal of the American Medical Association, JAMA, shows that lowering LDL cholesterol reduces the risk of heart attacks and strokes. Statins, a class of drugs commonly prescribed to lower cholesterol, have been shown to be highly effective in reducing cardiovascular risk. Obesity. Obesity significantly increases the risk of heart disease, as excess fat leads to inflammation, insulin resistance, and other issues that strain the heart. The National Institutes of Health, NIH, report that maintaining a healthy weight through a balanced diet and exercise can significantly lower heart disease risk. If weight loss is necessary, gradual changes in diet and lifestyle rather than drastic or short-term approaches are the most sustainable and effective. By addressing and controlling these risk factors, you can substantially lower your chances of a heart attack. Regular checkups with your doctor, maintaining a healthy weight, controlling your blood pressure, and managing diabetes and cholesterol levels are essential components of a heart-healthy life. 8. The role of stress management and mental health in heart health. We often think of heart disease as a purely physical issue, but mental and emotional health plays a significant role in cardiovascular well-being. Stress, anxiety, and depression have all been shown to increase the risk of heart disease. With research from the American Psychological Association revealing that chronic stress can lead to high blood pressure, inflammation, and plaque buildup in the arteries, all of which increase the risk of heart attacks. Chronic stress, prolonged exposure to stress can have a direct and harmful effect on the heart. A study conducted by the Harvard T.H. Chan School of Public Health found that individuals who experience chronic stress are more likely to develop heart disease, particularly if they engage in unhealthy coping mechanisms such as smoking, overeating, or excessive drinking. Stress triggers the release of stress hormones like cortisol, which increases heart rate and blood pressure, putting additional strain on the cardiovascular system. Anxiety and depression. Both anxiety and depression have been strongly linked to an increased risk of heart disease. A 2018 study published in the Journal of the American Heart Association found that individuals with depression are more likely to experience cardiovascular events like heart attacks, possibly due to the negative effects depression has on heart rate variability, blood pressure, and inflammation. Similarly, individuals with anxiety disorders tend to experience increased levels of stress, which can directly contribute to heart disease. The role of mindfulness and relaxation techniques. Managing stress through mindfulness and relaxation techniques is essential for maintaining cardiovascular health. Dr. Herbert Benson, a Harvard Medical School cardiologist and pioneer of relaxation response techniques, developed methods like deep breathing and meditation to help patients reduce stress. Research shows that regular practice of mindfulness meditation, yoga, and even simple deep breathing exercises can lower blood pressure, reduce inflammation, and improve heart health. A meta-analysis conducted by the National Center for Complementary and Integrative Health found that mindfulness-based stress reduction, MBSR, significantly lowered blood pressure and reduced stress markers in individuals with hypertension. The practice of mindfulness helps reduce cortisol levels and calm the nervous system, which in turn protects the heart by lowering heart rate and blood pressure. Dr. Rachel Friedman, a clinical psychologist specializing in cardiovascular health, emphasizes that cultivating a regular practice of mindfulness can have profound effects on reducing cardiovascular risk. Sleep and heart health. Additionally, poor sleep quality has a direct impact on heart health. Studies from the American Heart Association have shown that individuals who sleep fewer than 6 hours per night are at a higher risk of developing cardiovascular disease. Sleep is vital for the body's repair mechanisms, including the heart, and chronic sleep deprivation can lead to issues such as high blood pressure, increased inflammation, and greater risk of a heart attack. Ensuring adequate, High-quality sleep is essential for maintaining heart health. In the end, the most profound lesson is this: your heart is your life's engine. Knowing how to respond to the early signs of a heart attack, acting quickly, and seeking immediate medical attention can save your life. But beyond the immediate, it's the lifestyle choices you make every day that have the greatest impact on your heart's health. Managing risk factors like blood pressure, cholesterol, and stress, along with making time for exercise, mindfulness, and regular health checks, will help keep your heart beating strong and steady for decades. So, I urge you to take this knowledge to heart, not just for yourself, but for your loved ones as well. Share this information with your family and friends. Help them recognize the signs, understand the importance of swift action, and encourage them to embrace heart-healthy habits. The gift of a healthy heart is not just in knowing the right actions to take during a crisis, but in being proactive and caring for your heart every day. Remember, the best way to show love to yourself and those around you is to take care of your heart before it's too late.